discuss the external diseases of the ear, nose. So first external, what I am taking the first, these are hardly 2-3 line question only. These are important clinically. Might be they cannot be asked in examination in your theory exam, but practically when you will be in the clinics, so you must know about those infection. So we are going to see first those infection. Then second part, we are going to see deviated nasal septum. So that is very important for examination. So second part is important for examination, and first part is important for practical and the clinical side. So cellulitis, as the name indicates, itis is the inflammation, cells. Okay, so the infection of skin around the nose and soft tissue, that infection is known as cellulitis. So what happens in the cellulitis? The cellulitis is basically the bacterial infection. In this infection, there will be redness, all feature of inflammation, pain, tenderness, redness will be there in cellulitis. So the organism which are common for cellulitis anywhere in the skin, same are common in the nose also. These are streptococci, staphylococci. Then feature, I told you, feature of inflammation would be there, redness, pain and swelling will be there, tenderness would be there. Then treatment, common treatment in modern medicine, they start with antibiotic, anti-inflammatory and analgesic. And if fever is there due to cellulitis, antipyretic. So antipyretic, analgesic, anti-inflammatory and antibiotics, these are the modern treatment. For homeopathy, the first one only drug for any itis, if redness is there, we have belladonna. Then belladonna is there, then all Marxol, Hipersul, Silesia. Silesia is very good antibiotic. Silesia is also very good antibiotic. So that's about the cellulitis. Next, nasal deformities. The deformity, there will be patients coming to your clinic with deformed nose. So what can be the causes of deformity? Whether these deformities are congenital. Some babies are born with the deformity, some due to the trauma, some due to the other disease, some due to the cancers and all tumors. So various deformity we are going to see. For saddle nose deformity. Saddle, you know, the horse riding and the camel riding, one for sitting, one shape like this is there, that is the saddle. So that shape is known as saddle shape deformity. Then hump deformity, one bulging, okay, on the camel you see that bulging is there. So that kind of the bulging is hump deformity. Then crooked nose, depression would be there. This is the saddle nose, okay, like this, concave or convex, that type of the deformity, you have saddle nose deformity. So in this, what happened, the septum, dorsum of the nose, the dorsum of the nose and septum is depressed, and that can be due to bones, cartilage or both. There can be damage to the cartilage only, there can be damage to the bone only, and there are certain patients where both bone and cartilages are damaged. Then next is the trauma. Trauma of the nose, as it is external organ, so any hitting, any accident can cause the trauma. So depressed fracture are the most common, okay, due to direct hitting to the nose, depressed. Then excessive removal of septum in SMR, submucous resection. For the treatment of DNS, when submucous resection is done by mistake or due to any reason, if excessive this resection is done, that can also cause this trauma to the septum and can cause the depressed nose. Then destruction of the septal cartilage. The septal cartilage may be destroyed, may be damaged due to hematoma. It can be due to hematoma. It can be due to pus formation, abscess is there. Then syphilis. Nowadays it is not common, but few years back this syphilis was common. And when it goes to the tertiary stage, it damages this cartilage and bone of the nose also. Even it can cause the perforation of the septum also. So that syphilis is also caused. Then tuberculosis, okay, the secondary tuberculosis can be there. Then leprosy is very important cause. Okay, leprosy is one of the cause, bacterial infection. Now treatment. The treatment mainly they need surgery. So augmentation rhinoplasty, the reconstruction of the damaged area is the treatment. So in that filling of the dorsum, but the damaged part is there, depressed part is there, that is filled. So cartilage can be repaired. That cartilage can be taken from the septal part or the auricle cartilage. This cartilage can be used. Then when the bone is required, okay, if the septum get damaged over here, then usually we take from iliac crest, that has the larger area on your hip bone on the iliac crest. So from there bone can be taken out and then that can be placed over here for repair. Then there are nowadays synthetic implants, synthetic materials are there, ready-made implants are there like silicone implant. then Teflon implant, these are there, can be used. Then autograft are prepared over allograft. So autograft means when you take the tissue of same patient, that is the autograft, those are preferred. But in case, rare case, in case of emergency also, some other person tissue can be taken, they are known as allograft. So these are the treatment surgery. Then hump, as I told you, that bulging is the hump deformity. So again, like previous deformity, here also only bone can be destroyed, bone can be damaged, only cartilage can be damaged, and both can be damaged. The treatment is almost same. Most of these treatment are surgical treatment. So reduction or the rhinoplasty can be done. Then exposure of nasal framework, we can go external approach as well as transnasal through the nose. That approach can be there, and that expanded part can be removed. Then broadening of the nose, the lateral wall, they can be narrowed. So that is the surgical treatment. Then crooked nose. Midline of dorsum from frontonasal angle, this is the frontonasal angle, to the tip of curve, this here, A or S shaped deformity is there, that can be there. In that, deviated septum will be there. Normal septum is a midline, that is very rare. Little deformity is there in almost all the person. But if deformity is more, then it can be there. Then the etiology, as I told you, congenital. It can be by birth also. It can be due to direct trauma also, and it can be due to certain other disease. And treatment for this, we have same rhinoplasty and septorhinoplasty. When only repair of the external nose is done, that is rhinoplasty. When along with the nose septum is corrected, that is septorhinoplasty is there. Now tumors. Some tumor, again tumor is clinically important. Okay, so this tumor of the nose can be congenital by birth, then benign, non-cancerous, then cancerous or malignant. So we'll see the tumor. So there can be dermoid. Okay, that dermoid swelling over the cyst, we will see the dermoid. That can be a simple dermoid or dermoid with sinus. What sinus mean? A closed cavity which has only one opening. So that opening may be internal or opening may be external. So when there is only one opening, we call it sinus. When it has a tract, we call it fistula. So dermoid can be plain without any opening, or it can be with the opening. Then encephalocele. Sometimes due to failure of fusion of the bone, congenitally by birth, or due to trauma, or due to any reason, from the gap of the bone, the meninges along with the part of brain, they can bulge out. So if only meninges bulge out, we call it meningocele. If along with the brain or CNS part comes out, we can call it encephalocele. And this nervous tissue, glial tissue, okay, that is the glioma. So these are the congenital tumor. Now you see here meningocele, encephalocele, and then you have herniation. So as I told you, from the brain tissue, here normally it takes time for the fusion of the bone. So through the gap, there can be bulging. That can be reduced. Now this can be reduced mainly, or with the surgery, we can treat this. So these are the seals coming out. Now it can be nasofrontal. As I told you here, if the gap is there, from this gap, the meninges can come out, the cranial tissue can come out. So nasofrontal, subcutaneous pulsatile. Okay, there will be pulsation. Subcutaneous pulsatile swelling will be there at the midline of root of the nose. Here, the pulsatile swelling will be there, and pulse-like feeling will be there. Then nasoethmoid here on the lateral side, along with the nasal bone and ethmoid bone, where this union is there, their swelling can be there on the side of the nose. Nasoorbit, it has communication with the orbit also. So failure of fusion of those bone can cause nasoorbital. It is reducible. As I told you, it can be reduced. So now treatment is again surgery. Surgically we can treat this. Then glioma. It is a portion of the encephalocele, okay, during embryonic development. So during embryonic development, it can come out. So subcutaneous swelling on the bridge, there the bridge of the nose can be there, the side of the nose can be there, and medial canthi of the eye, it can be there. So 60% of these glioma are extranasal, outside the nose. Within the nasal cavity, inside 30%, and 10% both, inside and outside. So these are, now dermoid. Dermoid are this skin swelling. Okay, these are the skin swelling. They are the midline swelling under the skin, in front of the nasal bone. It does not have any external opening. When opening is there, we call it sinus. When opening is not there, it is simply dermoid. So dermoid, again, the treatment of dermoid in modern medicine, surgery is there, but still we have got good result in small benign tumor and some congenital anomalies. Our medicine has got good results. If it is soft swelling is there, we can try the apis mellifica is the medicine. We can, this hemangioma is there, we have hemamelis is the medicine. Then thuja for any outgrowth, thuja is the medicine. Then calcarea floor is the medicine. So as